Hello and welcome to my web quest presentation. My name is Paige Conant and I am presenting on heart disease. Heart disease includes many different conditions, including myocardial infarction, congestive heart failure, arrhythmias like atrial fibrillation or non-sustained VTAC, and valvular issues like aortic stenosis or mitral prolapse. There's many risk factors for heart disease, including age, male gender, obesity, tobacco abuse, a family history, hypertension and high cholesterol, poor diet, stress, and inactivity can all cause a patient to develop heart disease. The search terms that I used for this web quest included heart disease support groups, and heart disease videos. As a patient, I was hoping to find reliable websites to provide valid and sound information. I also wanted to look for local support groups and events that patients can become involved with. So as I was searching these terms, I was pretending that I was a patient and how I would feel looking through these different search terms. When I searched heart disease, the very first 4 websites that came up were the Mayo Clinic, WebMD, American Heart Association, and the CDC. As a nurse, I was really happy to see these 4 pop up. I did not want to see Wikipedia, and I even looked for that, and it was all the way at the very bottom of my webpage, which I was very happy to find, because as a patient, they're going to click on the very first couple that they see, so I was happy to see that it was reliable websites that were coming up first. Each of these websites provided information very clearly, and it was in terms that were easy to understand. I think the Mayo Clinic was my favorite because it included an overview of symptoms, causes, risk factors, complications, diagnosing and treating, preventing, and it even provided a small section about coping and supportive management, which I think is very important, as we've been learning throughout the past couple of weeks how important it is that a disease is an illness and different people need support and cope in different ways. When I searched for heart disease support groups, this was one of the very first websites that came up. It's called Women Heart, the National Coalition for Women with Heart Disease. It is a national organization. They're based in Washington, D.C., but they have support groups and events all over the United States. Locally, I found monthly support groups that meet in Allentown and Langhorne. So for patients in our surrounding counties, Lancaster, Chester County, Bucks County, Allentown and Langhorne can be a little bit of a drive, but it is manageable if that patient wanted to meet monthly with a group of women who are all going through the same thing. Another program that I liked that this organization provides is called a Sister Match Program. It connects newly diagnosed women with a trained volunteer to provide support over the phone or a web chat. So if women can't get to these monthly support groups or go to yearly conferences, they can pick up the phone and chat with someone. Maybe they're having a bad day, they just want someone to listen to them. This Sister Match program provides that, which I thought was really, really neat. There's several tabs at the top of the page, and one is called a resource tab. When you click on that, it drops down reliable websites to visit, which I thought was great, healthy recipes, Affordable Care Act information, and how their insurance could play a role in their diagnosis, and everything's provided in Spanish if need be, which I thought was great. They also provide education on early detection and prevention, living with heart disease, and survivor stories, which were very encouraging. The last search term I used was heart disease videos. One of the first that came up was through Discovery Health. This video links cholesterol and heart disease and gives a great visual explanation of how your diet and your cholesterol intake can build up plaque in your arteries. I think this is great. Please watch this. It keeps your attention. It's short and sweet. It gives the factual information that the patient needs to hear. And what I really love about heart disease in the fact in ways that it's different from other disease processes is heart disease is something that you can almost control yourself with changing some of your lifestyle choices, like eating less cholesterol, exercising more, quitting tobacco. Those kind of things are within your control to stop or to manage. And it's different as in, where patients with maybe cancer, there's treatments, but their body may not respond to treatments. So that's the way their body reacts to chemotherapy or radiation is not within their control, but heart disease is. So this video gives a very clear explanation about the link between cholesterol and heart disease and how that can cause a heart attack. Similarities in our weekly readings. I liked that all the websites gave very factual information. It was clear to understand, and the information that I was finding on the websites was matching up with the information that we were reading. I did like that when I searched for support groups, many were offered, and we've been learning that having support is really important in managing a disease and improving quality of life. Differences in the weekly readings. I found a lot actually. I did not feel that the websites gave information on emotional hardship or depression. It really stuck with the facts, and I think patients need to be aware that with a disease and with the illness that they're facing, they're going to experience a quality of life change, and they need to be aware of some of the emotions and feelings that they might start experiencing. I didn't see a difference in addressing disease and illness, and I sometimes saw illness used in the wrong context when it should have been labeled as disease. And nowhere in the websites did I see a mention of trajectories. It didn't really go over timeline of the illness. It just went over an overview of symptoms and how to diagnose and treat. Additional information, please take a few moments to watch the YouTube videos I've provided. They give a great visual. They're quick, they're easy to keep your attention, and I think you'll find a lot of good information in them. In conclusion, if I were the patient, I would feel very well informed by the internet search. But as nurses, we still need to encourage patients to discuss these disease processes with their doctors, because some of the symptoms or treatments may not pertain to the patient directly. So it is important that we're telling patients, if you're going to the website for information, please discuss with your doctor, because he or she is ultimately the one that's going to help manage your case, and so that's important for the patients to realize. That is the end of my web quest. I hope you learned something. I look forward to seeing your feedback. Thank you for listening.